are joined by the Secretary of State for Health and Social Care, Victoria Atkins, the MP for Louth and Horncastle.
Hello.
Lovely to see you this morning, Minister. Thank you for joining me.
Lovely to see you too.
We've been talking this morning, I've had Kwasi Kwarteng in the studio and others talking about whether the budget was a bit too Labour light. According to the Sunday Telegraph, half the public don't think it will make any difference to their finances. It's not a ringing endorsement of what the Chancellor announced on Wednesday, is it?
Well, look, this is a budget that delivered a tax cut, the second consecutive tax cut over the last two fiscal events for 29 million people who are working. That is a significant tax cut for them. We know that for the average worker on some £35,400, they will see an overall tax cut of £900. For my nurses, my hospital porters, my receptionists and many others who work in the NHS, that will be a very significant addition to their pay packets. But we've also managed to achieve through this budget not just that tax cut, we've also been able to help 500,000 families with child benefit. We know there have been difficulties at the very top end of the threshold for child benefit. 500,000 families are about to see benefits of up to £1,200 from those changes. And in addition to that, the Chancellor was able to protect day-to-day spending for my department, for the NHS, but importantly also to prepare the NHS for the future with our £3.4 billion productivity package, which is really great news. This plan is going to really help prepare the NHS for the future.
Health Secretary, I can understand why you're happy with the budget, because obviously you did get that extra funding for healthcare. There is an argument, however, to say, you know, how long does the government go on pouring money into the NHS if it needs to be reformed and it needs to be more value for money and it needs to cut waste?
Well, Camilla, you and I are as one on that, in that we know we're spending record amounts on the NHS. We have more doctors and nurses than ever before. That is fantastic news. But we also know that in the 10 years between 2010 and 2020, the productivity rate of the NHS was higher than it is today. Now, look, we had a very difficult time during the pandemic, and it is taking time to recover from the pandemic, which is why, for example, we have fully funded recovery plans for emergency services, for elective operations and so on, and for primary care. But we want to go further. And this productivity plan, that is fully funded, by the way, means that we will be using technology and AI to not only improve the working lives of doctors and nurses, so they're spending more time with patients than they are with paperwork, but also critically using state-of-the-art scanners and other technology to make sure that when patients go in for their diagnoses, they are getting the best and the quickest service they possibly can.
Patients do need to get in for those diagnoses, don't they?
And fairer.
OK, but patients actually have to get through the door, and there are waiting lists now. They're approaching 8 million. People will rightly be asking themselves, how does this money, how does the digitisation project get the waiting list down? So tell us unequivocally, when will the waiting list come down, and how much will they come down by, say, by the end of next year?
So we have already seen, the last 3 months, we have seen waiting lists decrease. And that is despite industrial action. So a huge amount of energy. Between, well, November to January, it's about 150, 160,000. We've got the cumulative figures. It is the start of what I want to see, our recovery across these plans.
It's a drop in the ocean, isn't it, compared to 8 million?
Well, yeah, and you are right, absolutely. We are absolutely right to focus on this. We have had industrial action. We know that's had an impact. So, for example, for the 12 months from December last year, we saw some 1.4 million appointments cancelled. There will be listeners and viewers at home watching this who have had their own appointments cancelled. But despite that, we've been able to make some progress. I am determined that we go further than this, and this is why the investment that we heard at the budget is so significant, because not only will we keep the foot on the accelerator when it comes to electives, to those waiting lists, but also I want to help clinicians spend more time looking at patients, as I say, than looking at computer screens. We know from looking around the world, some of these computer systems, they can help free up to a quarter of a clinician's time in a single appointment. And that's how we're going to improve productivity.
The NHS has problems in the past with computer system rollouts, but nevertheless, one of our people People's panellist was asking how you stop the exodus of good doctors and nurses to the likes of Australia, Canada and New Zealand. I mean, you've got the junior doctors and others calling for higher wages. That's what's going to stop them, isn't it? Otherwise, if they feel they're better off in other countries and indeed they're under less pressure, they're going to move away.
Well, actually, we have more doctors and more nurses today than we have ever had. To put that into context, we've something like 250 more doctors each month and something like 400 nurses each month for every month we have been in power since 2010. But you are right to say, to challenge me on, what are we doing both to recruit but also to retain doctors and nurses? And this is why this week I was really pleased that I've been able to find a settlement with consultants, which they're putting to their members. I hope their consultants will feel able to support it, that will help ensure that we bring an end to industrial action for consultants. With junior doctors, I have said to them, I want to do a deal. They have already had a pay increase of up to 10.3% this year, but I want to do a deal. It is a great shame, I think, that they walked away from those negotiations last year. But if they come back to the table with reasonable expectations, I want to do a deal. And what is more, I'm not just looking at pay. I want to act on some of the concerns I've heard from not just doctors but nurses and other people working in the NHS about their working conditions. I think the NHS cares for us and the NHS should also care for its staff. And so I'm determined not just to look at pay but also to look at working conditions as well.
Just a final question, Health Secretary, on anti-Semitism in healthcare. I know you've been investigating one particular doctor who was suspended from the medical register for a litany of anti-Semitic, racist and sexist messages. But then he may be back in his post, this Dr. Pakis. He may be back in his post in 3 months' time. Should doctors who are being anti-Semitic, racist and sexist ever get their jobs back?
So I hope you'll understand, Camilla, I can't comment on individual cases, but what I can tell your audience is that some months ago I wrote to both NHS England and to the regulators across healthcare to underline our expectation that their members and staff working in the NHS will adhere to the values of the NHS, and that any incidents of language or views that do not sit in accordance with those views, that they will be challenged and dealt with by, forgive me, I'm going to fly without my earpiece, that they will be dealt with appropriately and accordingly. And I do, everybody in the NHS, everybody in the regulators I know wants to ensure that those standards are maintained.
Okay.
I'm really sorry I've lost my earpiece, so I'm just going to have to assume that I can
see the Health Secretary, Victoria Atkins, has lost her earpiece, but thank you very much to her for joining us this morning.